I'm Dr. Frita, and today we're talking about kidney pain versus back pain. 5 warning signs you should never ignore. I'm a board-certified kidney doctor, and one of the most common reasons that people come to see me in my office is because they have back pain and they want to know if it's their kidneys. They'll wake up and be like, "Doc, I woke up this morning with back pain. I don't know if I pulled something, if I slept wrong, or is it my kidneys?" And I understand this question, I do, because back pain is actually one of the most common reasons that people over the age of 40 go to the doctor. And of course, your kidneys are located in your lower back. And so I get the confusion, I get the question. But truth of the matter is that most of the time, back pain is not related to kidney pain. It's true, but how do you know? Well, I'll tell you how you know. Today, I'm going to break down the difference between run-of-the-mill benign back pain versus pain that could be signaling something really serious going on with your kidneys. I'm going to break it down in plain English so that it makes sense to you and you know what to do. Keep watching. Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. Please go ahead and hit that like button because I am Dr. Frita. I'm a board certified kidney doctor. So taking care of kidney disease is what I do day in and day out. I'm about to give you some evidence-based information that you definitely want to share with a friend. Let's get into it. Kidney pain versus back pain. Here are 5 warning signs and symptoms you should never ignore. Number 1, lower back pain with fever or chills. Okay, when it comes to simple back pain, I'm talking about musculoskeletal back pain, muscular pain. Well, simple back pain usually shows up alone. It doesn't bring anyone else to the party. So when you have a lower back pain and it has other symptoms such as fever or chills, that is a red flag that it could be something more serious and could even be your kidneys. In this case, fever or chills with lower back pain could signify a very serious kidney infection or pyelonephritis. Pyelonephritis is a UTI, a urinary tract infection, but it's not just a bladder infection. It's actually an infection of your kidneys, and it can be very, very serious and cause an overwhelming infection in your body. It can lead to sepsis or even septic shock. And yes, if left unchecked, it could be life-threatening. When do you see your doctor? If you have fever or chills with low back pain, yes, definitely contact your doctor. And if your symptoms are getting worse, or if you have a very high fever, you may need to call 911 or go to urgent care or to the ER. Question: before watching this video, what was your biggest concern regarding lower back pain? Please comment down below. Number 2, back pain with blood in the urine. Oh yes, now this is something that you want to watch out for. If you have blood in the urine, yes, it could be red, it could be bright red, but blood in the urine can also show up as being pink or as little red dots in the urine or even little orange dots in the urine. Guess what? If your urine looks the color of coffee or like dark soda, that could also be blood in the urine. And if this blood in the urine is combined with lower back pain, then it very well could be signifying a very serious kidney disease. For example, if you have back pain and the back pain radiates to your groin especially, and you have blood in the urine, that could mean that you have a kidney stone or nephrolithiasis. Also, if you have a serious kidney infection, that pyelonephritis, it could also show up as back pain plus blood in the urine. Inflammation of your kidney cells could do it as well. Yes, glomerulonephritis can show up as blood in the urine. When do you see your doctor? Anytime you have back pain with blood in the urine. Yes, you never want to ignore this. If that blood is coming from your urine, contact your doctor. And if your symptoms are severe or if that blood is bright red, again, you might want to go to the ER. Always consult your doctor. Be sure to check out my video on the painful truth about kidney stones after you finish watching this video. Number 3, nausea or vomiting with severe back pain. When you have severe pain, especially if you have severe kidney pain, sometimes it can be so bad that it makes your whole body sick. So if you're experiencing symptoms like a low back pain, and then it comes in waves, okay? It comes and goes. It's severe and then it calms down. It's severe and then it calms down. And especially if those waves of pain are going from your flank towards your groin and you start having nausea or vomiting, this very well could be classic pain of a kidney stone. A kidney infection can also cause severe back pain with nausea or vomiting. So when do you see your doctor? If this back pain is severe to the point where it's not letting up, contact your doctor. Also, if you're having vomiting and you're not able to keep in fluids, call your doctor because that could lead to dehydration. And we know that dehydration in and of itself could lead to kidney disease. Oh, another thing about kidney stone pain, oftentimes my patients will pace or they shift positions and they just have a hard time getting comfortable. Number 4, pain that does not get better with movement. This is important because yes, most lower back pain is going to be muscular pain, right? Musculoskeletal. And the thing about muscle pain is that it usually will change with movement. It might get worse when you bend a certain position. It might get better when you stretch. It might get better when you lie down. There's typically some type of a positional change when it's just kind of a run-of-the-mill muscle pain. But when it's a kidney pain, that pain is usually persistent. It doesn't care if you're sitting, standing, walking, bending. If it's an internal kidney pain, it usually does not get better. Try this out. Next time you pull a muscle in your back and you're pretty sure it's muscular pain, stretch out, lie down, and see if that pain changes with movement. It probably will. If it doesn't, that might be a warning sign that something more serious is going on. When do you see your doctor? If you have an internal ache, a persistent pain, especially if it's severe and if it's not getting better after a few days. You also want to see your doctor if this internal pain that's not changing with movement is paired with some of the other warning signs and symptoms we've discussed, like fever or certainly blood in the urine. I love sharing medical information with you through videos like this, but if you want to have a deeper conversation with me one-on-one, I do offer a telehealth concierge service. With this service, I can help you with your medical issues from anywhere in the world. I am an MD, I'm a medical doctor, and I have been quadruple board certified. I read medical journals every single day, no exaggeration. I love to learn, and more importantly, I love to share my knowledge with you. And so if you want to talk to me about one of your medical issues, if you want to get a second opinion, if you want to get a first opinion, please book a telehealth concierge appointment with me today. Just click the link in the description or visit my one-stop shop, dr.frita.com. Number 5, if you have a history of high blood pressure or diabetes. Okay, so high blood pressure is not a symptom in and of itself. Diabetes is not a symptom, but these are two very serious chronic illnesses. And if you have lower back pain and you have one of these illnesses, then you actually are at risk for having something serious, okay? So having these chronic conditions and having low back pain is an automatic red flag. Let me tell you what I mean. If you have high blood pressure and you get back pain, it could mean that you're having an aortic dissection. That is when there is a tear or a defect in your aorta, the biggest artery in your body, and it can lead to severe problems. It could lead to you not being alive. It could lead to strokes and other issues. If you have high blood pressure and back pain, that could also be an atypical symptom or an abnormal symptom that signifies heart disease. So yes, if you have high blood pressure and back pain, that's automatically a warning sign you should never ignore. And then when it comes to diabetes, you already know that diabetes puts you at risk for heart disease, strokes, infections, yes. So if you have diabetes and you have back pain, that could be your one warning sign that you have a kidney infection. So basically, if you have these chronic medical conditions, high blood pressure or diabetes, don't even bother sitting at home with the guessing game for low back pain. Automatically contact your doctor. Question: what kidney health topics would you like to see covered in a future video? Please comment. I do want to mention a couple of other warning signs you should never ignore when it comes to back pain, even if it's not directly related to the kidneys. If you have back pain and you also have neurological symptoms, you want to watch out. So if you have back pain plus tingling or weakness in your legs, if you have back pain plus bladder or bowel incontinence, okay? If you're urinating on yourself or if you can't hold your bowels. Also, if you have back pain plus a numbness in your saddle area, meaning the area that's covered by a saddle, if you were to sit on a horse, if that's numb, plus you have back pain, all of these are very serious warning signs and symptoms. Not necessarily related to the kidneys, but I would be remiss if I didn't mention them. Call 911, contact your doctor if you have any of those neurological symptoms with your back pain. So remember, if you have back pain that is combined with fever or chills, blood in the urine, nausea or vomiting, pain that does not go away with movement, or if you have chronic conditions like high blood pressure or diabetes, all of these are warning signs or symptoms you should never ignore, and you want to consult with your doctor immediately. So there you have it. These are 5 of the warning signs and symptoms you should never ignore when it comes to differentiating kidney pain versus just run-of-the-mill muscular back pain. Having this knowledge will help you to better partner with your doctor and to better understand your own body. If you found the information in this video to be helpful, please hit that like button and subscribe. As always, I appreciate your support. I will continue to give you evidence-based medical information, and I want you to continue to live your healthiest, happiest life. I'm Dr. Frita.